Time now for this week's Health Matters. P.A. Linzabo in the Fug House. Paul Kritz with you. And we're discussing, do they still put the little thing on your driver's license?
Yeah.
Do they still?
Yeah, we'll get to that.
Okay. So organ donation.
Yeah, why haven't we talked about it before? It's so important.
We've been busy with other things.
Yeah, with that whole COVID nightmare, which is coming back. But anyway.
What do we need to know? Don't say that. A little foreshadowing. But what do we need to know about organ donation, Linzabo?
Well, on any one day, about 100,000 people need organs to survive. And about 20 of those people in that list actually die because they don't get them. So these are seriously ill people and a larger percent of our population than you would think. So, and this is cool. One donor can meet the donation needs of up to 75 people.
Whoa.
Depending on the medical situation. Mm-hmm. I did not know that. I thought maybe 5 tops.
Organ donation, tissue donation, all those things, right? Everything. Mm-hmm. Wow.
Yeah, it's increasingly common in the exam room. If somebody had like a ACL repair or something, then I've started asking it with cadaver tissue, and so super common, not that uncommon at all. And particularly important up here for a couple of different populations. The ethnic minorities need specific matching points, and they don't really have the availability of donors in those populations, and so Native American population and Hispanic American population really have a huge need.
So over and above just concerns of like blood type and compatibility of tissues and organs that are donated, there are more specific things you need to look for as far as ethnicities.
Depends organ to organ, and it probably is like more intensely difficult to find somebody, like if you're matching a heart as opposed to like an ACL.
Right.
So it's an anterior cruciate ligament that's in the knee. Yeah.
And so it's like a genetic. I mean, that's why family members are preferred as far as organ donation.
I don't think so.
Really?
Actually,
am I just imagining? Okay. All right.
I mean, we're all family, right?
Yep,
at some level.
Sure.
So not necessarily. Somebody's could rule out donation from siblings and parents, and then find somebody on a random data search. So not necessarily.
Okay.
So common myths about it. This was appalling, and I thought it should be addressed actually. So the first one is that the hospital staff will work hard to prevent the death of an organ donor, and as opposed to somebody who's not an organ donor.
So that just kind of flies in the face of being
like somehow
healthcare.
You're better if real estate if you're a donor. So just want to remind everybody, physicians take the Hippocratic Oath, right, which is do no harm. So I was astounded when I saw that because I have never heard of it or even thought it was a possibility.
Wow. Okay.
Yeah. So no, that would be a myth. So
that's good to know. The doctors aren't going, oh, you don't deserve your liver as much as somebody else does, so we'll just let you go.
Yeah, we take care of people all the time who personally were not like super happy about their life choices or about who they are, and that changes care for the most part, not an iota.
Okay.
Right. So there you go. They don't let people die. They don't. Anyway. And then maybe the hospital staff will sign a death certificate before somebody actually dies. So if somebody's kind of incapacitated, gravely ill, on their way out, that somehow, if they want the organs, they'll just speed that process along. That would be murder. So that doesn't happen either.
Okay.
Yeah. No, people don't try and off patients to get their heart and things like that.
Okay. So all of this, the way it was written in your notes here was a little confusing to me because it was written as a statement and then it was answered as a question.
Right.
So the hospital staff, you said maybe the hospital staff will sign a death certificate before the patient dies and the organ harvest will happen while someone is still alive.
So end of statement. And then the next question is, really? No.
Gotcha. That's not
seriously
a thing. Okay.
So whether you're an organ donor or not doesn't define the length of time that you have on the earth. You get good care and to the extent of the resources that are available always. Okay.
Yeah, but I understand maybe wanting to fill out a death certificate a little bit early because you're saving on paperwork, and if you're going to harvest donors, if you're going to harvest organs, like time would be of the essence, you know.
No, it's not like that. In fact, death certificates, there's physicians don't like signing them because I think one thing is, there's probably too much paperwork, but, mortuaries chase physicians around. And by the way, PAs can't sign them, NPs can't sign them. So a little bit in COVID we were allowed to, but that was taken away from us pretty quickly because we got to the usual number of deaths again. So there wasn't a need for us to step in. So, nobody signs death certificates early.
Why do mortuaries chase doctors?
Because mortuaries get the bodies after the person is dead.
That's how it works.
That generates the death certificate.
Oh.
That generates the need for the doctor to fill it out and sign it.
Oh.
They are filled out, like we've talked about before, with immediate cause of death. Okay, so usually it's cardiorespiratory failure or something. And then a more related cause of death, say blunt force trauma. And then a step back, where did the blunt force trauma come from? Motor vehicle accident. Okay, so there was a thought that because almost always it's cardiopulmonary arrest, and there was a thought that people weren't actually dying of COVID because on the death certificate
it would just say that, right?
Yeah, so death certificates are not, they're way more, there's layers of complexity of them that most people are not aware of.
And there's an episode in which there's an episode of Health Matters in which you discuss that very point. I remember that vis-a-vis COVID.
So it's not amenable to a database search and thinking that you understand the complexities of it.
And that's what people were doing to make a big deal out of it. Okay, so I just have no idea how the paperwork of death works anyway. So a death certificate isn't generated until after a body has been given to the mortuary.
They're generated by the mortuary.
Oh, geez. Okay. All right.
Yeah. So no, there's no filling it out early.
Okay.
So I don't know that anticipatory paperwork happens a lot in medicine because we're always so far behind.
Right. Anyway, there's no way to get that far ahead.
Yeah. Right? I can't think of very many. I don't know. Maybe a work excuse for a sick day or something. So the next thing is organ donations are against religious beliefs. So yes, that is true. In a small number of established religions in the United States, kind of have prohibition on that. But the majority of established religions in the United States, specifically Catholic, Islam, and most Jewish faiths and most Protestant faiths, have beliefs that are consistent with organ donation.
Wow. Okay.
I think
that strikes me. That's unexpected, especially with Islam and Judaism, if only because of the kind of cultural prohibitions against mutilation, but marking of the body, changing of the body. That's a surprise that they're okay with organ donation.
Right. So if you have a specific question, then ask your clergy person. So I think we make assumptions that turn out not to be true. Anyway, so how about pediatric patients? Could there be anything sadder than parents being asked to donate their children's organs?
Well, yeah.
So pediatric patients are allowed, these are people under 18, are allowed to have an opinion on whether they can be organ donors or not. And there probably should be a conversation between parents and children. The adults over 18, guardians or parents are responsible for the final decision. But I know I had the talk with my kids, and I had one kid who was like really opposed to it, and one kid was like, in her usual style, why is this even a question?
Wow.
Of course I'm going to do it. So I think it's one of those moments in parenting where you really should have an open line of communication with your kid, because it's better to have the decision kind of clarified ahead of time for an event that for both of us would be unimaginable, and honoring the wishes of our kids. So I never saw that coming as a requirement for parenthood, but Yeah.
I never had that conversation with my kids. It never even occurred to me.
Right. It didn't occur to me until they were teenagers. And I was doing my own organ donor planning and stuff. And I was surprised actually that one was there was the opposite reaction, like, to the extreme. That's kind of interesting.
Do you remember any justification from the kid who didn't want any part of it? Why?
So I have an artist and a scientist. So the scientist was like, of course I am. And the artist was like horrified to the point of silence. Yeah, you can't really see my face that I just made, but
Just dumbfounded that you'd even ask.
So she like couldn't even go there. She couldn't even. So it wasn't a very long conversation, because immediately she's looking at me like, "What are you planning?"
Yeah,
Mom?
what's going on?
So I'm like, "Hey, it's chill. I just wanted to know. Okay, hopefully we won't even be having this conversation," and we never did so far. So pretty funny. Let's see. That the donor. This is one I hear a lot actually. A donor would not be able to have an open casket funeral because the body is going to be quote unquote mutilated.
Sure.
I have been present during a lot of autopsies, and not really during organ pulls, although PAs do a lot of that, kind of in the bigger world. And number one, the bodies are treated super respectfully, no matter what the situation. And number two, we've figured out how to take people apart and then put them back together looking, fairly normalized. Okay, so people are dressed. People's eyes are closed, and there really isn't a mutilation that's visible during an open casket.
I'm really sorry. I must be really uncomfortable with this because it just gets funnier and funnier to me, and I can't. I just putting them back together and having parts left over, and thus was born the idea of organ donation. I
don't think that was it.
Yeah, I don't think so either.
I think it was some doctor working on his car on the weekend.
Exactly.
Thought, if I could just,
I have a quick historical question.
Sure.
When did we start donating and transplanting organs? I forget. What was the first organ transplant?
I don't know for sure, but probably longer ago than we yeah.
Because I mean, the first heart transplant was what, late 40s, early 50s, something like that, right?
Yeah.
Yeah. And I can't. But before, I mean, I can't imagine we started with hearts.
I know, that's kind of funny, but that's where the immediate need is. I mean,
I suppose, yeah. Huh?
You can be blind and still be alive.
Right.
Okay.
And it might be much more straightforward to hook up a heart than it would be to hook up a kidney.
I would think so.
Yeah, that's just an assumption. I don't know.
I would think so, but I think the people who are passionate about it probably brought a lot of creative thought to it. And I've seen a lot of weird donations.
Yeah.
That were thinking outside the box. Like I did see a woman who had a donated kidney, but it was so kidneys are under your back ribs, right? I don't care what your grandma told you, they're under the back ribs.
What was grandma say?
Grandma says they're in the lower back.
Oh, way down low. No,
Yeah,
they're
but
up
there's
high.
actually,
They're up high, yeah.
if you think about it, A, there's no room there, and B, it's perfect to have them under the posterior ribs because they're protected. Okay, they have like a little bony gel in there.
Yeah.
So, but I saw a woman actually, and I don't know why, she had a kidney placed in her anterior left abdomen. So her lower abdomen on the left.
Wow, like where the...
So it was almost visible.
Where her appendix should have been?
The appendix is on the right.
Oh, okay.
But, where her sigmoid colon should have been.
Okay, wow.
But it was actually visible. So transplantations, there's like the run of the mill, and there's probably, for reasons that I don't understand because I'm not a transplant surgeon, there's definitely the atypical.
Yeah, just medically necessary, or this is the only room you had left, or something
like that. And she allowed me to palpate it, but she was really protective of it.
I bet,
because A, it was her life, and B, it was super tender.
And it wasn't hers.
Wasn't protected. Yeah. So anyway, yes, you can have an open casket funeral. It's not a problem.
This next point is interesting to me. Older people and ill people wouldn't be able to donate.
Yeah, this is kind of... Well, the reason this whole talk is inspired is that I lost a patient recently, and I was, in reading his discharge summary, it was prominently discussed about his wish to organ donate, and he was truly sick. And so the parts of his body that that failed that caused him to die were not the parts he donated, obviously. But if you've got like a potential to help 75 people, there's a lot of parts in there that we don't normally think about. So we think of heart, we think of kidneys, we think of liver, but we don't think of tendons, and we don't think of retinas, and we don't, so our, all those little things that kind of are not an entire organ, but are pieces of what make us function every day.
Do you know when they match donors with donated organs, or donors rather to recipients? Do they try to age match? Like if
they do if it's relevant to sizing. For example, an adult liver probably couldn't go in a 7-year-old child.
Sure. But they don't think like, oh, it's a waste to put this 25-year-old liver in this 50-year-old guy.
So that would be being God, I think. And I don't think that they have, that's an objective viewpoint. No, subjective viewpoint, not very objective.
Where's the line drawn being God? We're the ones cutting out organs and putting them in other people.
I know, but it's a data-driven process.
That's true.
Not
that's
like
true.
just
it's just like
slapping
judgment,
them into whatever. So... you're a more valuable person, so you get the heart.
Exactly.
That absolutely does not happen. So, but
well, no, I could see it being a reasonable sort of decision to go, okay, here's a heart that's maybe got another 60 years of life in it, and here's a person that's only got another 30 years of life in it. Why don't we put the heart in a younger recipient where we know it's going to
maybe
time
because
out
it won't biochemically match with any other one, and otherwise you'd be wasting it.
Okay.
So there's way more that goes into it than you'd think.
Yeah, obviously.
Way more. So the other thing where I thought you were going with that question, which is actually kind of interesting. So what if somebody's HIV positive and they need like a liver transplant? They have a little, what used to be called non-A, non-B, we talked about last week, and their liver's, kaput. And so do you give somebody a quote unquote, air quotes here, a good liver into a person maybe who you could get judgy about, which you totally shouldn't? Or what if you're transplanting a liver from somebody who's HIV positive into another person who's HIV positive? And so what are the complexities of that? Well, the first thing that comes to my mind is, HIV is a lot of different strains.
Right.
And so it's better for the person to only fight their one strain of HIV and not be given a new strain. So how do you decide things like that? There's schematics and, kind of outlined methods to decide all this, and it's super complex.
Yeah.
So way beyond family practice PA. But so stuff you have to consider. How about if somebody has Hep C and they want to donate their liver to somebody who has worse Hep C. So, stuff like that is all taken into consideration, but on a very objective way. Yeah, kind of interesting. Huh?
No, that is interesting. And I wonder then if you've got somebody who has like Hep C, and they've got an organ that is healthy and is a liver that's, does that cure the Hep C?
No.
Do you just reinfect what you get new? Because I'm just curious with that. I'm also curious about what does it do to the aging process? Does the aging process that's kind of genetically bound to the organ stay like expressed in that organ in a new host?
I imagine so, but that's what they do, immunosuppressive stuff, and I think that's part of it. Part of it that they do.
That's another thing I was grown up before I realized was if you do get an organ donated to you and you need it, you're on medication for the rest of your life because your body is going to actively try to get rid of that organ forever.
And some of these organs have a shelf life, It's like people get their first heart transplant maybe as an infant, and then, they kind of run the mileage down on that, and then they're looking for one as an adult.
Run the mileage down on that, meaning do you mean that like donated organs don't last as long just generally, or is it just a specific case by case?
It's case by case, but it's not unknown. So kind of interesting. But let's see. Oh, and so older people are also able to donate because we got miles on our tires doesn't mean we can't help. So what do you do? So some people in their lives have decided that they're on a path where they feel like called to donate one of their kidneys.
Okay.
So what do they do if they're not like, hey, I'm donating to my cousin? If there isn't an intended
Right.
donation, that's a match. Well, we've seen from Grey's Anatomy, right?
No, I was an ER guy, but
Oh,
go
you're
on.
an ER guy. So you can actually have like a domino surgery where a kidney can be donated to an individual who has an individual willing to another individual willing to donate a kidney, willing to donate a kidney. So like 10
Like everybody like switch kidneys one to the left,
right,
kind of thing?
and you
Okay.
just kind of change the conditions, the physiologic identifiers and markers until you get to the original friend of the original donor who actually gets a kidney out of it.
Okay.
Do you see what I mean?
You're paying it forward.
Yeah, totally. That's
Got
a
it.
better, way elegant way of saying it.
Okay.
Yeah, so those are called domino surgeries, and they're actually becoming more and more common.
Huh.
So yeah, mostly with kidneys.
Now you can as well. I mean, if you've got a family member, Lisa, my wife, may one day need a kidney, and she's got, because the kind of person she is, she's got everybody lined up around her going, "I've got one, I've got one, I've got one."
Right on.
So you can do that.
Lisa.
You can match make, right? You can go in and say,
Yeah, so A can give it to B, and B's friend C can donate in
Right.
B's name to D.
I guess you don't have to jump into the organ donation lottery. You can come with somebody if they are a match and
Right,
just
it's
kind of
like
go.
a weird
this is what-
conga line.
Yeah.
Yeah,
It's like a weird.
yeah,
Okay.
yeah. So
Oh my God. And I'm sorry again about how funny I'm finding on just organ donation. I think it's the only way I can get through just what I see is a deeply unsettling and macabre topic to discuss.
oh really? I think it's so life affirming.
Well, good for you.
I was
That's
so
nice.
inspired by my patient recently. So, although I wish these decisions you weren't ones that he had to face, but he pulled it out with an incredible amount of grace and kind-heartedness.
Well, I will be doing it with laughing, so that's how I'll deal.
Right.
So
Maybe you're number one on the conga line. What do you know?
does that make me a celebrity?
No, I hope you guys are just all well. How about that?
That's good.
Yeah. So speaking of celebrities, are celebrities given priority for organs? The answer is absolutely not.
Right on.
I suppose they could go somewhere and buy one, but not in the United States.
So that's a thing, right? The organ black market.
Right.
Right, that the waking up in a bathtub full of ice and missing a kidney, that's not just an urban myth, right? That's happened to people, isn't it? I guess in India now, young men in India
yeah.
are selling their organs to get some sort of
people
money.
are incredibly desperate. Yeah.
So what happens to those organs? Do they go into the legit pool, or do they stay under the radar and are kind of like traded around black market?
First of all, it doesn't happen in the United States. Second of all, they're traded around. I mean, that's obviously shady.
Yeah.
So
I just didn't know if it was because of they were trying to meet the legitimate concern of the organ donation system, or if they were just going,
no, I think
screw
it
it,
was
we're going to
somebody
make
with money.
profit. Yeah.
Somebody with money.
Okay.
So it does not happen in the United States. The whole line of who's in line and who's first, who's at the top. I mean, it's all really complex in how they figure that out, and it's also like changing second by second. It's very, very dynamic. And so in a half an hour, somebody could go from number 3 on the heart list to number 1.
Well, you said, what was it, 20 people a day who are on the list don't make it, right?
Yeah, they don't make it. So these are really, really sick people. And then, so what do you do to sign up to be a donor? So 3 steps, okay? Going back to the driver's license. The first step, however, is to register with your state's organ registry, okay? And that's organdonor.gov.
Okay, we skipped something. I'm very sorry, and it's an interesting thing I've never heard.
Okay.
There was a point in your notes
yeah.
here. My family will be charged for organ donations.
Super important. No, the charges, there are charges.
And that's what was interesting. There are charges,
Yeah.
but you don't. If you're the donor, it doesn't go to you; it goes to the recipient.
Right.
You have to. You
So
get
there
the
are charges, but it goes to the recipient.
organ in a bill.
Yeah, so people don't have to pay to do the good deed. Okay?
Oh my God!
And insurance wouldn't even cover it anyway.
Insurance,
for the donor.
Oh, for the donor. Okay.
Yeah.
Okay.
Yeah.
But what about wow. So is there a going rate? Is there an actuary table an insurance thing somewhere that this is how much a liver, this is what we'll pay for a liver, just for the liver, just for the organ, separate from the transplant
Yeah, there probably
process.
is, but that's stupid. I
Well,
mean,
yeah, it's
because
stupid,
each particular situation is completely unique. It depends on the state of the two people, how healthy, they both are, what kind of matching they need that's particular, what kind of transportation they need. Like, is it something that could come from Tennessee, to Del Norte?
And all of those factors will come with the price tag in today's medicine and capitalism. So I assume the thing in the cooler, just in and of itself has some price attached to it too. And I was just wondering how much, what's a kidney go for these days?
I actually don't think that's true.
Really? Okay.
No, that would not be ethical. I think it's everything around it, though. It has a price tag, and I think it's like you'll get something like a weird grocery receipt.
Right. Yeah.
But yeah, I mean everything down to how many pieces of gauze were used, and surgical
and every
trays
person in the room, sends you an invoice too.
Yeah, what it costs to fly the PA to Idaho to get it and fly him back to San Francisco, stuff like that.
Oh, okay.
Yeah.
The kidney cozy they had to buy.
They look like they're kind of interesting. They look like something you just bring your lunch to a construction site in.
Right. Yeah.
So there's really nothing special about it. It does have a bumper sticker that says, human organs biohazard. So.
Sorry. I just want to get one of those now and just go walk through random airports and see what happens. Okay. So.
No, you have to walk really fast.
Yeah. Right.
They look stressed. Because let me tell you, so interesting factoid. So when I was in PA school in North Carolina, I was co-ag tech at night. So that means I did studies on how people's blood coagulates. Okay, super important for a liver transplant. And that was like the mid 80s. So that was the beginning of liver transplants. But the
really?
lab,
Not until the mid 80s?
Yeah.
I had no idea. Okay.
The lab that I worked at was our ceiling was the helicopter landing pad.
Okay.
Hopefully with a lot of reinforcement, right?
Yeah.
And so I would hear at nighttime, the helicopter land. I mean, it's hard to not hear. And then I would hear footsteps running. And then I would know that it was possible I was going to be doing blood clotting studies on an individual like every 15 minutes for the rest of their life.
Yeah, okay.
Rest of the night. And I would just get all my ducks in a row to do that. And it was, how to explain it? It was super exciting. Yeah. And it was, these people were super sick. I could tell from their labs. Not very good. And I actually think a lot of them didn't survive. They were pioneers in that effort.
Because that was why. And again, I had no idea that just liver transplantation didn't start until the mid 80s. That's crazy. I did not know that. Anyway, I mean, it makes perfect sense. But once again, it goes back to the fact we started with the heart, but okay. It seems like there would have been easier things to do, but it's like you're doing the coagulant tests every 15 minutes on something. So it's a very, you're not just hooking up a couple of things and slapping it in a cavity. There's all sorts of things that go into this, managing it all the way down to the genetic level.
They're anticoagulated, usually if they have a bad liver, they're anticoagulated by their disease, and there's a huge bleeding risk, and they're watching. That's what blew me away is the test came in the blood draws were every 15 minutes.
Wow.
So there must have been a group of doctors right there.
Just waiting for the optimal
It's a
situation.
tertiary care medical center, so some brilliant minds, I imagine.
It had to have been exciting for you too to be up under the helipad and that kind of scrambling and like a firefighter throwing your feet in the boots and pulling your pants up and getting to work real quick that. That's cool.
It was super exciting. I mean, there's no other sound that it could be.
Yeah, right.
Anyway.
So I want to donate. So how do I get on the?
I want to donate. 3 steps. Register with your state's organ registry. So go to organdonor.gov to do this. Supposedly really easy. I actually haven't done it because when I registered to be a donor, there was just the little sticky thing on your driver's license.
Right? Yeah.
So I am a bone marrow donor, so I'm assuming I'm already in it, but it looks like I probably have to put it on my to-do list to make sure. Okay.
Organdonor.gov.
Right. Designate your choice on your driver's license. That's the step I have completed. So the little pink dot on my driver's license. And last, I guess, California ID card I got, what is it, real ID that we're all supposed to get?
Right.
Yeah. And I checked and my donor designation is on there, but it's not a pink dot anymore.
Oh, wow. Okay.
It's more like a hologram.
This is interesting, and this is key. I think this next step, this thing you put in here.
That you can do this when you obtain or renew your license.
No, the next one.
Okay. Tell your family your wishes.
Yeah.
And this is especially important if you're under 18, but we already talked about that. But, my kids know that that I'm a donor. And it's just the way it is. So make sure the people around you, and certainly your durable power of attorney. So a durable power of attorney for healthcare is the person who's making decisions for you when you're not able to. And sometimes, that's a happy accident, like you marry somebody, and sometimes you have to specifically designate it with notarized paperwork.
Right.
Okay.
Right.
And so I think in my panel at UHS, I have like 2 people who have wishes that are so specific that they went the notary route. But most people, it's just kind of an informal conversation someday. But I'll tell you, as a healthcare provider, it's probably better if you have something really specific and notarized and handed out, like at the hospital and at your primary care person, because you're throwing like super important decisions in somebody's lap who may not agree with what you find to be really important. And it's always better to give them a structure to make these difficult decisions. So,
okay. Well, we're just over time. So,
yeah.
Last thoughts on this, and we've gotten to the end of the notes.
Almost, yeah. So I know it was a more intense topic than I thought.
Am I wrong for having like issues with it? Like I want to go out with everything I came in with.
That's a legitimate worldview.
I don't think it's a defensible worldview, though. That's what I come back to. I'm going, yeah, and then I go, why? And then I think, well, that's dumb. So I'm not sure I can defend it even to myself.
I think you're just squeamish personally,
Maybe.
But I'm not sitting in your brain, so I don't know.
That's a possibility.
Yeah.
Ooh. All right, well, thanks for this. This was really good because tomorrow's Halloween, so...
Yay.
David's Haunted Manor and organ donation. I'm sure that'll show up. So any thoughts about next week's Health Matters?
I want to get Mike in here to talk about rural pharmacies. Super important and affecting both Humboldt and Del Norte counties recently. And people I see something coming, and I think Mike probably does too, that the Joe average is like not prepared for.
Wow. Okay.
Yeah.
Okay. Well, hopefully we can get him in and find out what that is. My gosh. Lynn Szabo, thank you very much for this week's Health Matters.